Okay, continuing with our examination of your thyroid, I want you to take a drink of this water, but I want you to take a sip and hold it in your mouth until I get my fingers in place, and then I'll tell you when to swallow. Okay, swallow. Okay.
I swallowed it all.
Okay, that's okay. Okay, here, take another drink. Okay, now I'm going to put my hand right here and move it to the left. Swallow a little. Okay, do it again. Okay, good job. Okay. Now, I will need, let's turn the chair around so I'm behind you. Okay. From behind, I want you to swallow. I'm going to feel for the isthmus. Okay, sorry. Okay, now I'm going to palpate the left. Okay, and the right. Okay, swallow. Okay, good job. Okay, thyroid is moving when you're swallowing, so that's good. You feel the lobe on each side. There's no nodules. Sorry. Okay. All right. Good job. Okay, now let's turn around. And we are going to check your visual acuity. So the first thing I want you to do is we're going to read on the chart over on the wall, the eye chart that's 20 feet away. I want you to cover your left eye and then cover your left eye with your hand, and then read on the chart the smallest line of the letters that you can read.
F, E, C, F, E.
Okay? Now change eyes to the right eye and read the smallest line that you can.
Okay, hold on a second, I gotta close this here.
Okay.
L-P-E-D.
Okay, good job. Okay, now we're going to check your near vision. I want you to look at the card and read the smallest line possible that you can read.
L-P-E-D. Z-D-F.
Okay. Now, we're going to check your peripheral vision. I want you to cover your left eye, and I'm going to cover my right eye. And tell me how many wiggling fingers you see in the center. How many fingers do you see?
2.
Okay. Now, change hands. And now, how many fingers do you see?
3.
Okay, good job. Now, we're going to do an external examination of your eyes. Okay, I'm going to look at your eyebrows. Okay, I'm going to look at the size. They extend right beyond your eyes. The hair texture is soft, not curly. They're equal on both sides. Okay. Now, I'm going to inspect the orbital area of your eye for puffiness. Okay, there's no edema or swelling noted. Any sagging of your eyes? Okay, can you open your eyelids, close your eyes, and then open wide for me? Okay, and then close again. Okay, and, okay, just, there's no flakiness noted, any kind of redness or swelling. And, let's see, your eyelashes curve up correctly, okay? Okay, there's no, okay, the eyes look good. palpate around here. Any pain or tenderness? Okay. Okay.
We can go now.
Okay. Sorry. Okay, you're not good. Okay. We're going to continue with this assessment for the ear, nose, and throat. Get my Okay, first I'm going to inspect your ear. Turn to the side for me. And we look at the auricle. The size and shape is normal. Okay. And they're both symmetrical. And the color of the skin appears the same as the rest of her body. That's normal. Okay, no protrusions. Okay, we got vertical line. Okay, there's symmetrical. Okay, there's no discharge or odor from the ear. Okay. Is there any kind of tenderness or pain when I palpate? Okay. Any pain or tenderness here? Okay, no swelling noted. Okay. I'm going to check your ear. Tell me if it hurts when Okay. And look in the other ear. There was no discharge. No scaling or redness. Okay. There is some cerumen in your ear, which is normal. There's not a lot of buildup or discharge from either ear. Let's see. I looked at your tympanic membrane, which appears clear, and there's no color change. They both appear the same. One more time. In the other ear. Okay. Now we need to evaluate your hearing. When I ask you a question, you've been able to answer, so I would say that you have good hearing. As far as when I'm talking to you in a normal voice, now I'm going to whisper and I want you to tell me if you hear me. Or tell me what you hear me say. What is your name? What is your name? Good job. So you can hear my whispered voice. We already performed the Weber test in the previous video. Okay, now I'm going to examine your nose. Okay, there is no deviation noted. Color is normal. Its alignment is correct. There's no kind of nasal discharge, any nasal flaring, no narrowing of the nose. Is there any tenderness when I touch here or here? Have you had any kind of discharge? Any kind of, when you blow your nose, do you have any kind of green or yellow discharge? Okay. Now I'm going to check the bridge and the soft tissues of your nose. Oh, sorry. Up here. Is there any tenderness here? Okay, now I'm going to check the patency of your nostrils. So I'm going to plug one side and I want you to breathe in the other. And out. Okay, now the other side. Okay, any problems there? Okay. Next I'm going to check your sinuses. Okay. Or here, first we're gonna Okay. Okay, good job. There was nice and pink on the inside. There was no discharges, no masses or lesions that I could see, or no swelling of the turbinates in your nose. Let's see. Now, I'm going to look. We're going to check the sinuses. So I want you to open your mouth for me. Okay. Now on the other side. Okay. Now I'm going to palpate your frontal sinuses. Tell me if there's any pain or tenderness. Okay. And there's no swelling. And I can feel the bones up here. Under. Okay. And no pain or tenderness there? Okay. Now I need to look at your mouth. Look at your lips first. They are symmetrical. No color change. No edema. No lesions noted. Okay. Now I want you to open your mouth for me and clench your teeth. And then smile. Okay. Okay. Now I need you to open your mouth. And I'm going to use this tongue blade to look at your gums and your teeth. Okay, open up for me. Stick your tongue out for me. Sorry. Sorry. You okay? Okay, sorry. I just need to look at your gums and teeth. Okay, they look good. Okay, now open for me. Okay, there's no lesions inside your mouth. Okay, your gums are pink. You can see between each tooth. Okay. The upper gums over here. Okay. There's no inflammation noted, no swelling. When you brush your teeth, do you have any problems with bleeding? Okay. Now I'm going to palpate your gums. Okay. Any tenderness when I do that? Okay. Now let me look in just at your teeth. Okay. You have previous fillings in the bottom right side and left side, in the very last two teeth. Okay. Alright, now I'm going to inspect your tongue. Can you stick your tongue out for me? There we go. Okay. It's red and moist. No lesions on your tongue that I could note. Okay. Now can you stick out your tongue? Try to stick your tongue straight out. Okay, no deviation. Now can you touch the tip of your tongue to the palate behind your upper incisors? Okay, now touch your tongue up to the roof of your mouth. Okay. Now I'm going to look at the lateral borders of your tongue. Open up for me. Okay, and the other side. Good job. And then I need to look at the floor of your mouth. Okay. Alright. And can you lean your head back and look at the palate and the uvula? Okay. Soft palate and the hard palate are noted in pink. The uvula is midline, no nodules. Okay. Now, I just need you to stick your tongue out and say ah, so I can look at your uvula. Okay. Ah. Okay, good job. Alright. That concludes this assessment.